Hello, hello. I'm going to wait just a minute to see if anyone hops on, but if not, I will get started with the video. But thank you for joining to learn more about chronic inflammation and nutrition and how this affects your overall health. If you do join, I would love for you to just post in the chat, if you have any questions, and then also share the video and with anyone who may be struggling with chronic pain. All right, we'll go ahead and get started. For those who do not know me, my name is Dr. Monica Tillett. I'm a doctor of physical therapy, and I'm the owner of New Direction Rehabilitation and Wellness. And we are a holistic wellness company that blends physical wellness with functional nutrition. I'm also a certified functional nutrition counselor. And really, what that is that we are educating adults on how to improve their health, to take control of their health through education, through movement, and nutritional changes. With any nutritional changes being made, you should always consult your physician because everyone has different medical conditions, and what's going to work for one person isn't going to work for another person. So, my job as a certified functional nutrition counselor is not to make, diet recommendations for you. It's to increase your knowledge on how certain foods can affect your health and your physical function, and then you, from that point, can have additional discussions with your healthcare professional, or make those changes yourself. But it's really about awareness, because as I've been treating patients as a physical therapist for 18 years, I have noticed that um, their nutrition has been a limiting factor in many of our outcomes. Because as a physical therapist, we may treat many of the symptoms, and there are some root causes that I treat that are not nutrition related. However, there are many, many, many conditions that I treat each day that are nutrition related. In addition to strength deficits, balance deficits, or movement deficits from neurological diseases. However, that's a whole nother topic that still nutrition heavily impacts those diseases. But the role of my role today in educating you on chronic inflammation and inflammation in general and how it affects your health is to keep it simple, because you don't want to sit through a biology class like I had to. You want simple, understandable information that you can apply to your daily life. Because if you don't understand it, then you're not going to apply it. So, my goal is to keep it simple for you. The first thing I want to talk about is that there are two types of inflammation that our bodies, our systems go through. One is called acute inflammation, and that is normal. Our bodies should be going through this phase. If you run into different type of, foreign bodies or something that's going to make you sick, our bodies are going to naturally go into an inflammatory response, which means it has our defense system, that's our immune system, and it sends out different cells to attack what's in our body that's not supposed to be there. Well, this whole process should really only take 1 to 3 days, depending on what the body is trying to fight off. So, your regular sickness, should be 1 to 3 days. COVID, can be longer than that. Or if you injure yourself, like spraining your ankle or straining your muscle, as these cells are released in the body to help heal those areas that are affected. Again, depending on the type of injury, should only take 1 to 3 days. But the point of the acute stage is to eliminate what's causing the sickness or damaging the tissues. It should turn off once the tissues are healed or once it has eliminated um, the problem, the situation. So that's normal. And during that phase, you may experience pain, you may have redness, you may also have some swelling or tenderness in that particular area. But again, it's something that should resolve. Chronic inflammation comes after this acute phase. If the acute phase does not really, it doesn't resolve the issue, it continues. The inflammatory response continues, meaning that the body is still continuing to send out its defense cells to take care of what is in the body that should not be in the body. But the problem with chronic inflammation is that when it continues to persist, it goes from healing the tissues to attacking your tissues, so damaging the tissues in many of the cases. And so that's why it's important to make sure that our bodies isn't going into this chronic inflammatory phase that could last, it could last 3 months, it could last longer than that. And you're probably thinking, well, how do I know if I'm going into, chronic inflammation? That's a wonderful question. So if you notice that the pain is persisting, maybe there's no more redness, there's no more swelling, um, but you're having pain or general aching or increased fatigue, you just know that your body is not right. You know that things don't feel the same. You don't feel like you're quite back to normal. It just feels like there's something just underlying there, right? And so that's kind of, just a cue. Okay, maybe there's something else going on. And so with chronic inflammation, you're going to see increase in your sensitivity to pain. So if you sprained your ankle, let's say, and you have pain and it never goes away. Say you came to me as a physical therapist and we're working on, ankle strengthening and other exercises to help with the pain, and you just find that it's getting a little better, but the pain is just there no matter what we do. It really could just be the fact that your body has transitioned into a chronic inflammatory phase, and now the pain signals are being intensified. And that's really the point that I'm getting to, as far as how does this relate to physical therapy? How does this relate to pain? How does this relate to movement? And it's because when pain persists, people stop moving, because you feel that if I stop moving this body part that hurts, then I'm going to feel better. But then as you're stopping the movements and you're not, you know, um, exercising or walking as much, then muscles get weak, balance is affected, falls can happen. I mean, it's just a domino effect sometimes. So just again increasing the awareness of, what is chronic inflammation and how it relates to function. Research is also showing that chronic inflammation has been linked to heart disease, type 2 diabetes, arthritis. I see that a lot. Alzheimer's disease, certain cancers, autoimmune diseases, and depression. And the reason why you're starting to see more research come out in relation to chronic inflammation and these types of diseases is because they are linking it back to nutrition. because the foods that we are taking into our body is either fueling our body and helping our body, or it's hurting our body. And so when it comes to those different types of diseases and the digestive system, you know, again, it's about what's fueling my body and what's hurting it. And a lot of times in chronic inflammation, it's the foods that we're eating that's hurting it, because the body now does not have, um, the nutrients it needs to fight off infections in a healthy way. We're eating things that are causing our body to go into what they consider that chronic inflammatory phase. And so we're going to talk about some foods that can help us reduce chronic inflammation in our bodies. But first, let's talk about the foods. And if you joined my live last week, when we talked a lot about how, some of the foods that we eat can send your body into inflammation. We're just going into a little bit more this week. But dairy, too much dairy on a daily basis can send our body into chronic inflammation. Excess sugar, lots of sugary drinks, cakes, pies, all the yummy, yummy stuff is not good for your body. That sugar will cause, it depresses your immune system, but it also sends your body into this chronic inflammatory phase. But then also alcohol, again, because there's a lot of sugar in alcohol as well. So those are just in high fatty processed foods. Those will send the body into chronic inflammation. So foods to help reduce chronic inflammation it sounds simple, because we hear about these things all the time, but eating fruits and vegetables, fresh fruits and vegetables help. Limiting our dairy intake, and then also our sugar consumption. So the sugar that we eat from cakes and pies, our body doesn't utilize that type of sugar as an energy source. It uses the sugars from fruits, because it converts those sugars to glucose. Again, not meant to be a biology lesson. However, there's two different types of sugars. Well, there's a few different types of sugars, but to keep it simple, the sugars that our body uses as fuel is the sugars that come from fruits. And so, therefore, if we make sure that we're getting in those healthy sugars. Now, if you're someone with diabetes, again, this is where the difference comes in with your individual medical conditions. If you have diabetes, you can't eat a whole lot of fruit. You have to be mindful about how much sugar you're taking in. But if you don't have diabetes, then yes, fruit, the fruit that you eat, the main thing that you may want to just consider is, well, what type of fruit am I eating? Because I don't want to eat the fruits that are still really high in sugar, like pineapple and grapes. But berries, melons, apples, those are great fruits to eat, because they have what they call a low glycemic index. So the sugar levels are lower. So those are great foods to eat. Also, eating a variety of vegetables. We call it Eat the Rainbow. And later, during my post this month, I am going to post this beautiful handout. Um, but you can't read that. But that's what the post, you'll see this come up. But it's a wheel with a lot of circles on it. I mean, a lot of colors on it. And in each color group, list the different vegetables and the different fruits that correspond to the colors. And then it lets you know why those fruits and vegetables, what nutrients it provides to the body. So it's just a great handout for you to have in general as you're trying to think about the different foods that come into your body. But eating the rainbow, try and mix things up a little bit because each food has different nutrients, and it's great to be able to get a variety in because research again shows that an average adult only eats about 20 to 30 different foods, and there's just so many different things out there. Me myself, I said I need to try a new vegetable and a new fruit each week. I'm a person of habit, so I love eating the things that I already know taste good. And so this is a stretch for me. I'm trying to tie in new things, but it's a good goal to have. And that's just my personal goal. Foods also rich in omega 3s, such as salmon, sardines, walnuts, flaxseed. Those are great. It helps build our immune system, increasing our fiber. And we do this through, eating more vegetables. Some of you may have a fiber supplement that you take, but fiber is important because our digestive system needs it to get out of our system, without going into much detail, get out of our system what it no longer needs. That's just a normal function of the body. The fiber helps it to move out in a normal time frame. If we lack the fiber, then the foods are staying in our digestive tract too long, which is causing the body to reabsorb toxins that it's trying to get out of the body. And that's another reason why we're seeing chronic inflammation and so many diseases being linked to the digestive system. It's because it's one, not we're not eating enough of the nutrients we need, or two, we may be eating it but our digestive system is not functioning well enough to absorb the nutrients that we need, and or lastly, we're not able to expel the foods out of our system the way that we need to. All right. um and then healthy proteins are great, and fish, beans, chicken, those types of things. All right, so let's wind it down because again, it's not meant to be a biology class. So let's talk about some exercises that helps decrease chronic inflammation. One, it's really just movement. You want to do gentle or moderate intensity exercises, nothing strenuous, because strenuous exercise, again, it causes the body to say, whoa, we need to, this is too much, you've used too much energy, or our muscles work really really hard, and now it's trying to figure out what it can do to help protect the muscles. So walking, gentle strengthening exercises, cycling, swimming, those types of things are going to be great exercises to do. Flexibility exercises, which is really just stretching. If you notice that, your hamstrings are a little tight, or you're noticing that your back is a little stiff, just doing some gentle stretching exercises to just decrease the stiffness is wonderful. And Tai Chi and also yoga have been shown to reduce chronic inflammation. So, if you're again thinking about, well, how much exercise should I do? The CDC recommends 150 minutes of moderate intensity exercise per week. So 5 days a week at 30 minutes, or you can do a little more one day or a little less. But the point is to move. And I feel that it's important to not focus so much on how much you're doing. You know, for instance, if you're getting to 150 minutes a week, is that recommended? Absolutely. But is 60 minutes or 80 minutes or 90 minutes a week better than getting 0 minutes? Yes. So start slow, and build yourself up, especially if it's exercise isn't something that you've done on a consistent or regular basis. And also, balance training is a great way to help reduce chronic inflammation, because, especially in the balance programs that my company um, has put together, the balance programs deal a lot with strength and balance. So you get a good combination into one program. And so if you are looking for some exercise programs, then go to my website, newdirectionrehab.com. We have some great online programs for balance, but we also have, if you're looking to learn more, a little bit more in depth than what I've covered tonight on chronic inflammation, then we have a program there that you can sign up for to learn more about that. And then we have a free program that talks about how nutrition affects your physical function in general. So we have lots of great programs. And if you're looking for one-on-one guidance, maybe your chronic pain is limiting your ability to walk or do other things, there are one-on-one options available on my website. So I put the link in the description. I hope this was helpful to you. And every month, the first Monday of the month at 6 p.m. Eastern Time or 5 p.m. Central Time, I will come on and discuss a new health topic that will relate to nutrition and physical wellness. Because again, we need both to function optimally and live well. Again, thank you for joining and enjoy your evening.